Welcome back, listeners. We are in our pilot episode of the worldwide launch of Eagle Radio International, and our segment is dubbed "Let's Pick Your Brain." We are with Dr. Minerva Navarro from Palo Alto, California. Doctor, you still there? Doctor? I think Dr. Navarro can't hear us. We can't hear her either. Hold on. So earlier we discussed the types of, well, we focused on memory loss and differentiated Alzheimer's with dementia. And as we continue, we will tackle how to address memory loss, how to help our loved ones if they're suffering from this kind of disease. Dr. Minerva Navarro, are you still there?
I can hear you.
There you go. I thought you left us already.
I think we're just having some technical difficulty.
Okay, welcome back, Dr. Navarro. To continue our discussion, if our loved ones, let's say they're suffering from memory loss, how do we address that? How can we help them? What are our initial steps to help them?
So the initial steps for helping our loved ones with memory loss is not to conceal or hide the memory loss from the rest of the public. It's very common to see how a nurturing spouse would hide memory loss manifestation from the rest of the children or from the rest of their social circle. But is once you see a glimpse that your loved one is having some signs of potential memory loss, not related to age-related memory loss, is to seek medical help. Because the earlier that someone is suffering from, for example, dementia, can prepare that person and the people around that person with this journey. So that's my recommendation. Seek medical help when you're noticing that your loved one is manifesting some memory loss.
That's good advice, doctor. Well, in some parts of the world, especially in the third world countries where people don't have the means to go to doctors, or they're probably challenged in that aspect, what can we do? What can they do? Are there exercises? Are there, can they go through like therapies to help this kind of illnesses?
We usually recommend that the memory loss can be assessed, whether this is, an age-related memory loss or something that is much more than that, like a dementia. But terms, keeping a brain healthy also requires keeping your body healthy. That means that a healthy diet, meaning like 5 servings of fruits and vegetables, getting yourself hydrated adequately, getting a balance of carbohydrates, proteins, and all these micronutrients is part of it. Exercising regularly, both aerobic and resistance training will help your body and your brain get enough oxygen. Sleeping enough, 8 hours a day, getting your brain the adequate rest that it needs, help your brain cells get healthier. Avoiding toxins in your body like tobacco, alcohol, and recreational drugs will also help. Keeping yourself active in general, involving yourselves into society, not isolating yourself. So having that language go on, social interaction, having readings, doing some puzzles, learning new hobbies. Like if you've never played a piano, try to learn new things, like learn to play new instruments. That will help your brain function. It stimulates your brain function.
So diet and exercise play a big role, and not abusing your body. You mentioned something
Correct.
about smoking and vices.
Yes,
So those are things that we should avoid to delay or avoid memory loss.
exactly. So it's never too late to quit on those vices. Even if, for example, you're a 70-year-old and you've smoked all your life, it's never too late to quit smoking and prevent that toxin getting into your body. The same thing with alcohol and recreational drugs, the street drugs that we talk about.
All right. How about um, medicine or surgery? Does surgery help in memory loss?
So there is no surgical procedure that helps with memory loss at this time. And whatever we have in the market, so first of all, you have to you need to establish that your memory loss is pathologic. So assessment is very important. Um, Seek a provider who specializes in memory loss, able to determine whether your memory loss is something that fits into one of the causes of dementia or one of the types of dementia. And if that is the case, they usually do a cognitive testing, certain blood work, and probably head imaging. And when they determine that that is probably, a pathologic type of memory loss, such as dementia, then there are some medications that can help slow down the process of this progressive memory loss. We'll speak specifically for Alzheimer's disease, because that's what we know. That's the kind of dementia that we have some of these medications being able to help them. So for our Alzheimer's disease, there are medications that are in the market, two types of medications in the market that help slow down the process of the memory loss and some of the behavior that comes with it.
You talk about medication, and
Mm-hmm.
go ahead, doctor.
There are two types of medications that we currently use when we suspect Alzheimer's dementia, Alzheimer's disease. The reason I say suspect is because even we do cognitive testing, blood tests, and head imaging, we can only say probable Alzheimer's disease. For diagnosing Alzheimer's disease is brain tissue biopsy, which we don't do for most of our patients. So, but anyway, if we suspect, if there is a high likelihood that someone has Alzheimer's disease, we usually give one or two types of medications. These are medications that are available in United States, primarily because I practice here. One type of medication, they are called cholinesterase inhibitors, and the second type is called memantine. So your doctor may determine which medication is appropriate for you or for your loved one, or a combination of these two medications is appropriate for you.
So these are prescription medicines.
These are prescription medications,
Right.
yes.
How about genetics? Does it play a role?
For Alzheimer's disease, we can say that 70% of people with Alzheimer's disease, genetic does play a role.
Well, it's too bad, doctor. We're running out of time. But as we wrap up what's going on in our discussion for tonight, you said we have to keep being active physically and mentally, and we have to open up. We have to be open in being assessed by a doctor if we're suffering from, or we suspect from suffering from memory loss. Is there anything else that you can add to our listeners so that they can prevent or at least delay memory loss?
So I think the other thing that I would like to recommend is when your loved one is suspected to have dementia, the reason we would like they get assessed by a medical provider is we can help that person and the people around that person plan for the future. Dementia, like Alzheimer's disease, is a slow progressive disease that worsens over a period of 3 to 10 years, and unfortunately it doesn't get better, it just gets worse. So the earlier we detect it, the earlier we can also plan for the future for this person who may be suffering from dementia, and also helping the family loved ones adapt with these changes and the changes that may happen in the future.
Right. And what can you say about joining focus groups, discussion groups, and being open about this kind of illness? Does that help?
Definitely. Whenever I see a patient brought by family and we suspect that it is Alzheimer's disease, I do refer them to alzheimers.org. It is a not-for-profit, and it's for the public. They have not just website resources, paper resources, but they do provide healthcare professional resources for these families and patients that may be suffering from Alzheimer's disease.
I see. Do we have to sign up for that website, or can we just browse it?
So they have a website. It's called alz.org, and there is a portion there that says contact us, and you can send an email or a phone number depending on where your local chapter of Alzheimer's Association is, or you can have your healthcare provider, send an official referral to the organization.
Well, thank you very much, Dr. Minerva Navarro from Palo Alto, California. And hope to see you again next time, Doctor.
No problem.
Well, join us again next week for more medical concerns regarding the elderly. You are listening to, we are ending our segment, Let's Pick Your Brain, produced by Eagle Radio International. I'm Mace Ramirez, broadcasting from Washington, D.C.